Louise Meadows is 30 years old and has 2 children. She was born without arms or legs.
Used to feed you like this, didn't I?
Her disability is not due to illness, accident or inherited disease. It was caused by a drug taken by her mother when she was 6 weeks pregnant, when Louise's bones were starting to form.
Between 1958 and 1962, pregnant women were prescribed a wonder drug. It was given to them to stop morning sickness, which it did, but it had dire consequences for the babies. They were born disabled, and they became commonly known as thalidomide.
Louise was one of 460 thalidomide babies born in Britain. The tragedy raised serious questions about the testing of drugs on animals. Although thalidomide was tested on animals, the tests did not show that the drug may harm unborn babies. Following the tragedy, the 1968 Medicines Act introduced much tougher guidelines for animal tests.
As a result, in many ways, of things like the thalidomide tragedy, much more safety testing can now be done. And that has the consequence of meaning using more animals, unfortunately. For example, we can test the medicine nowadays not only in the mother animal, but also then her offspring are brought to maturity, and then they can also become pregnant, and we test the medicine in them also.
Once a potential new drug has been discovered, it has to go through various safety tests. The first stage is to test on a rodent. More than 80% of all animals used for tests are rodents.
In this study, we're giving rats an injection of drug into the vein. We're putting them into a restraining device so they keep still, so they cannot do themselves any harm while we're doing the procedure.
The drug being tested here prevents blood clotting. A study like this can take up to 28 days. If there are no side effects, then a small dose of the drug is given to human volunteers.
Here in this unit we have a group of healthy young men who have volunteered to be human guinea pigs. They have been given for the very first time a brand new drug which will prevent clotting of the blood.
It's probably the quickest way we found to make money in London. Usually getting about £100 a day or something to that effect.
We've been assured on coming into this unit that there have been so few fatalities. In fact, any fatality that there has been caused by negligence on the part of the person being tested for the drug, that really I feel there's very little risk at all involved.
If the human volunteer tests are successful, more animal tests are done over a period of 6 to 12 months.
If the drug is intended to be given to humans for, say, their lifespan, we'd have to do a lifespan study in the rat, and we'd do that for up to 2 years.
It's during this stage that tests are also done on pregnant animals. Each mouse and rabbit fetus is carefully examined for defects. These skeletons have been preserved and stained to show up the bones.
Here we're looking at a rabbit skeleton. As you can see, all the elements present in a human skeleton are also present in the skeleton of a rabbit fetus. If we look at the limb, you can see that all the elements present in the front limb are also the same as the human skeleton. There are 5 digits present on the end of the limb. There are 2 bones here, 1 bone here. These bones are also present in the human skeleton. And there's very little difference between the front limb and the hind limb. The animal has a spine in the same way that humans have a spine, and this is composed of individual numbers of vertebrae. Humans don't have a tail, but they are just a case of specialised vertebrae. There are ribs present, and sternibry present, and skull bones.
This is also a rabbit fetus, but its mother was given a drug like thalidomide. Its skeleton is deformed. If scientists had tested thalidomide on rabbits, the tragedy might have been prevented. However, deformities like this don't show up in rats. So, if a brand new drug is tested, they've got to know in advance which animal behaves like humans.
There are many reasons why animals are not absolutely perfect predictors of what's going to happen in human beings. This is one of the big reasons. This is a drug, amphetamine, which is also known as speed, a stimulant. If we give this drug to different animal species, the drug is broken down in their body to another substance. In the rabbit, this part of the amphetamine is chopped off and an oxygen and a hydrogen are added. In the rat, the oxygen and hydrogen are added, but in a different position down here. And in human beings, mice, dogs and guinea pigs, we produce a completely different substance, benzoic acid.
In the case of the anti-blood clotting drug, rabbits and rats do behave like humans. But scientists only know that because they've tested similar drugs before. For new types of drugs, it's safer to test at least 2 species.
The drug we're testing today has been tested extensively in rats, rabbits, and in monkeys. In monkeys, we look particularly to see what effect it had on the heart and the electrical conduction of the heart. So the test we're doing today in healthy volunteers will be looking particularly for the same effect.
Since 1968, all drugs have to be tested on 2 species. Dogs and primates may be used in the final stages of drug development.
We try and avoid the use of monkeys as much as possible, but there are certain circumstances where it's better to use a monkey than to use a dog. This monkey is having an ECG taken. Basically, we're monitoring what's happening in its heart, seeing if there's any response after we've given the drug. It is having a greater dose than the human volunteer, but we're particularly looking at the blood levels to see if that's higher than the human volunteer, and it will be higher because we're looking at a margin of safety between the human and the monkey.
The 1968 Medicines Act was designed to increase protection for pregnant women and their unborn babies. But the irony is that because of the dangers, new drugs are rarely tested on women who may be pregnant.
The reason all our volunteers are men is a knock-on effect from the thalidomide tragedy, which occurred in the early 60s, and hence we're always worried that any woman that we might use could be pregnant, and no contraceptive is going to be 100% safe. And we're left with this big gap where we can't do anything to ensure safety for the baby or the mother.
The first pregnancy I didn't take anything, but the second one with this little one, Jack, I did take paracetamol, because I was in a lot of pain. They did say it didn't go through the placenta, but they couldn't be sure that it wouldn't.
Women who are ill and sterile women are used in drug trials after tests in pregnant animals. Pregnant women are only used in extreme cases. Avoiding drugs when pregnant is the safest option for the baby.
As you can see, it turned out to be quite normal. And quite hungry.
The function of good clinical development of new drugs is for us to balance the risk and the benefit. The benefits that the pharmaceutical industry gives the world with new drugs is enormous. The risks have to be taken by all sorts of people. Many of them are healthy volunteers. Some of them are patients who are also exposing themselves to new drugs for the very first time. But without any risk at all, there will be no benefit at all.
But just how valid are scientific tests on animals?
One of the main problems with animal tests is that rats and mice are not miniature human beings. There are differences between the species of animals as to how they react to drugs. And that means that the results of animal tests are not always reliable for human beings. In fact, surveys of animal tests have shown that on average, they only predict up to a maximum of 1/4 of the side effects that you might see in a human being. And for cancer tests, they've shown to be reliable only just over 1/3 of the time. And so we can't rely on animal tests to tell us what will happen when a drug goes into a human being.
As a veterinary surgeon, I think it's unfortunate that we do need to use animals in research, but I also know that it's necessary. It's the only way in which we're going to find answers to problems of human disease and indeed animal disease. And the alternatives are not going to give us those answers, unfortunately. Animals are different from people, of course they are. Mice have tails. But bear in mind they also have hearts, they have lungs, they have livers, they have kidneys, just the same as we do. And there are many, many similarities. So those similarities far outweigh the differences between them.
The testing of drugs in animals before they're given to human beings is now being reviewed very carefully. And we are now fairly certain that a large number of the tests that are being done in animals are unnecessary.
I'm 14 years old and I'm an insulin-dependent diabetic. I've had diabetes for just over a year now and I have to inject myself twice daily with insulin. Insulin was discovered in 1922 by testing on animals. If they hadn't have done that then, I wouldn't be here now.
Using animals to test shampoos and perfumes is unacceptable for many people. Images like this have made some consumers switch to cruelty-free brands. As a result, the number of animal tests carried out for cosmetic purposes has decreased dramatically.
Most of the reductions in animal tests have been because of pressure from the public and the cosmetic companies. But at the same time, we are working towards alternative methods that don't use animals. We use cells growing in culture from human tissue, wherever we can get them. This is human skin on the monitor here. And we can use these for testing of materials that are applied to the skin, such as cosmetics. We have here some human skin that was obtained from the burns unit in Birmingham. And this is being prepared, ready so that the cells within that skin layer can be isolated and then put into culture and grown so that we can increase the number of cells that we have.
The top layer of skin, called the epidermis, is separated and divided into single cells.
The cells are put into this flask in a liquid that contains all that they need to make them grow. They attach to the bottom of the flask and then they start to grow.
These are skin cells multiplying over a 2-day period. Once the cells have grown, 10,000 of them are placed in each of these wells. The drug or cosmetic that's being tested is then added to each well.
We can tell if cells are healthy by how well they take up this red dye, which here looks very dark because it's very, very concentrated. Healthy cells will take this dye inside of them, whereas unhealthy cells won't take it up at all.
The dye is then added to the mixture. Using a computer, the amount of dye taken up by the cells can be analysed. The less dye taken up by the cells, the more toxic the substance.
Nobody wants to see another disaster like has happened in the past with some drugs. What we need to do to prevent that in the future is to find out more about how these effects occur so that we can develop better tests, perhaps not using animals at all, perhaps using cells in culture or using computer modelling techniques.
Computer images allow us to imagine how buildings or cars will look in the future. Now computer graphics can be used to visualize and study molecules which exist but can't be seen. These are models of molecules which can be viewed in 3D with special glasses. Scientists hope that graphics like these will replace some of the drug tests done on animals. Using graphics, we can represent the structure of molecules in the human body. Toxic substances generally have small molecules which can fit inside the larger ones. It's a bit like breaking into a car. When the wire forces a particular section inside the lock, the car door opens. In the same way, if this drug, which has a small molecule, fits this larger one found in our body, then it is toxic. In this case, we can see that it does, and therefore it may be dangerous. Computer models like this one may one day replace tests on animals altogether.
Hello, I've come to see the nurse.
Hello, love. What name is it, please?
Louise Ramsden.
Louise has just discovered she's diabetic. The treatment that will save her life was discovered using animal experiments.
Come in. Oh, hello. You must be Louise.
Yes.
Do sit down, Louise. I'm Margaret Moran, diabetes nurse specialist.
Louise's body can't make a substance called insulin, which helps us get energy from sugar in our blood. Insulin is produced by an organ called the pancreas, which is found just behind the stomach. The white specks are made up of cells which produce insulin. The function of insulin is to enable sugar in the form of glucose to pass from the blood into the cells. If insulin is absent, glucose can't enter and the cells are starved of fuel. Sugar accumulates in the blood. Because the muscles are starved of sugar, the body makes energy from its fat and protein reserves, so the person loses a lot of weight.
Until he gets a good covering like that.
It's important that diabetics check their blood sugar levels regularly.
And you press the timer there, so in our So you can see that's 23.4, Louise, and that's far too high at the moment. But it's nothing to worry about because the doctor will just give you some more insulin tonight and bring it down. Let's compare it against this colour chart.
Because diabetes has been known about for a very long period of time. In fact, it's been recorded back at the time of the Greeks. And when they referred to diabetes because it was a wasting disease, you passed so much urine that you had to drink a lot and you lost a lot of weight. And in those days, you would die from the disease because you were unable to correct it. And it wasn't really until 1921 when probably the most famous couple who won a Nobel Prize, Banting and Bess, first described the origins of diabetes in the pancreas. What they actually did was, and some previous co-workers, removed the pancreas from dogs, in fact. And on removing this pancreas, the dogs immediately became diabetic. In other words, what they started to do is drink a lot and pass a lot of urine, and ultimately they would die within a few weeks. They then found that by taking extracts of this pancreas and mixing it up in a laboratory situation and then giving it back to the animals, that they corrected the problem of diabetes and they would be back to their normal selves.
When insulin was injected into human diabetics, the results were dramatic. Until 1982, all insulin was made from the pancreas of ox and pigs. But today, most insulin is made by microbes. In these vats, genetically engineered yeast produces insulin, which is chemically identical to human insulin.
The problem with insulin is that it has to be injected. And one hopes that in the not too distant future, an oral insulin preparation will become available. And that would make life for the diabetics much better.
And go straight in from there like that, right? Push the insulin in, pull it out, and then put your finger over it. Okay? Right.
Yeah.
Okay.